Welcome back to the show. I'm glad you're watching. Before we went on a break, we were talking about some of the social dynamics and crises that have emerged, the teenage pregnancies, our children, being influenced, sexualization of our society, and especially among young people. I know we haven't exhausted those issues, but we are going to now begin to address some other issues. Remember, overall, we want to look at how the COVID-19 pandemic has affected our health systems and the implications of that, and how our society has changed actually since last year in March. And so I'm going to ask Dr. Wahome to comment on the idea that we have had a lot of statistics thrown at us since March. We started now having daily briefings, and we were given a lot of data, and especially in regard to the crisis, and then the preferences, the recoveries. And as a medical doctor, I'm sure you observe those things, and you have your something to say about this. So kindly elaborate on what you really take about all this information and how it has affected how we deal with this crisis.
Yes, to be honest, for my whole practice,
yes,
I've never seen anything like this.
Yes,
we were always trained to offer hope.
Yes.
And there's an example I give commonly. Assume I find that you have a very bad cancer, and the survival rate is maybe 10%.
Okay.
I can give you this information in two ways.
Yes.
I can tell you, my brother, the chance that you're going to die is 90%.
Yes.
Kindly organize yourself, write a will, go and talk to your family. Things are very thick.
Yes.
Okay.
Yeah.
Then I have the other option of saying you have a very serious illness.
Yes.
The chance of survival is about 10%.
Yes.
And we are going to do everything we can
yes.
to make sure that you're in that 10%.
Yes.
Now the statistic is the same.
Yes.
But one gives total hopelessness.
Yes.
And the other one gives hope.
Yes.
And the second one is the one that is really what medicine is about.
Yes.
There is disease.
Yes.
And that's why I went to school.
Yes.
And my business then is to make sure if you get sick,
yes,
that you get the best possible outcome.
Yes.
Otherwise, what is my value?
As a doctor.
Yes. If I come and I tell you there is a disease and you're going to die,
yes,
then what is my place in society?
That's a very serious issue.
Yes, because what I should be saying is true, there is a disease.
Yes.
And true, it is serious.
Yes.
But this is what we are going to do.
Yes.
So this is the first time I've seen in my whole medical practice.
Yes.
Where we have a press release every day.
Yes.
Telling us of how many people have been infected, how many people have died, and what. And then immediately after that, you're told stay at home. Stuff. Huh?
Yes.
So I found that very traumatic.
Yes.
Extremely traumatic.
Yes.
The other thing that was very traumatic as a medical provider is, again, it was a very new disease,
mm-hmm.
and we knew very little about it.
Yes.
And it is everywhere in the world.
Okay.
So right now you can't say you are COVID expert.
Yes.
Because we have been studying this disease from March.
Yes.
And it didn't care whether you are a gynecologist or a pediatrician or a general practitioner.
Yes.
You needed to find information because patients are coming to you and they're asking questions.
Yes.
So you have this disease that is killing people.
Yes.
And you cannot stay at home.
Yes.
Because you're part of the team that's supposed to help.
Yes.
And yet you know very little about it and how it will be managed.
Okay.
And then there was no treatment. There was no known treatment.
Yes.
And it was very pathetic that people would come, they're sick, they're sick, but you can't do anything about it. And so the initial phase of the disease was very traumatic.
Yes.
But now, if you were to go and then pull back a little and say, let's just look at what is on the ground.
Yeah.
And you find the projections that were given initially were very high.
Yeah.
So far, unfortunately, we've lost about 1,750 Kenyans.
Yes.
So there is mortality, and that is, of course, unfortunate.
Yes.
Because every life matters.
Yes.
But the initial projection was about 4% of the people who got infected would die.
Okay.
We are now at about 100,000 confirmed cases.
Yes.
Which would mean we would have lost about 4,000 people so far.
Yes.
Okay. So the first thing I would do
Yes.
is just first congratulate Kenyans.
Yes.
For taking the measures that were given to them seriously.
Yes.
Because it is based on that we have been able to achieve what we have achieved.
Yes.
Okay, so we've been able to suppress and reduce the death rate.
Yes.
Because of the cooperation of Kenyans. But as a medical practitioner, I would have loved it more if people understood
yes.
what we are dealing with
yes.
and why they are doing what they are doing.
Yes.
If you look at the deaths of 1,700 since March,
yes.
2019, it was estimated we lost 21,000 people to HIV/AIDS.
Okay.
We lost about another 10,500 to malaria.
Okay.
Road accidents last year, we lost about 3,000 people.
Yeah.
So in terms of severity,
yes,
you are likely to die from a road accident and from malaria more than from COVID-19.
Okay.
So that's the first thing.
Yes.
Now, majority of the people are healing, even without treatment.
Yes. Yes.
But the few who get sick,
yes,
get very sick and have a very high risk of death.
Yes.
So what Kenyans need to understand is that even though this disease is spreading very rapidly,
yes,
is very infectious,
yes,
its mortality is not that bad among the majority.
Yes.
But we cannot tell
yes,
who will get severe disease and who will not.
Exactly.
That's why we can't be careless.
Yes.
But it is something that now we know we can manage.
Yes.
The concept of the mask is one of the most profound ones.
Yes.
Because unfortunately with this disease, for the first about 6 days,
yes,
when you're shedding the virus,
yeah,
you have no symptoms.
Wow.
So nobody knows you're sick, even you.
Yes.
But you're spreading it.
Yes.
And that was very, very important to learn right at the beginning.
Yes.
So before symptoms develop, you're already spreading the disease.
Okay.
And that's why containment in terms of restricted movements and others were slowing down but could not stop the disease.
Yes.
Because by the time we knew you had the disease, already another few people, and that's why the contact tracing was being done.
Yes.
But because of how infectious the disease is, it was always a step ahead.
Yes.
So when it came to mandatory use of the mask,
yes,
and a lot has been said, there is a lot of controversy out there about whether masks are useful or not.
Yeah.
But the logic is very simple.
Yeah.
When we go to theater as doctors, the reason we wear the surgical mask is not to protect ourselves from the patient.
Yes.
Is to protect the wound that we create in surgery,
yeah,
not to get that bacteria from our mouth and get infected.
Yes.
So the concept of stopping the droplets from infecting the surgical site has been known for donkey years.
Okay? Yeah, that's is a part of the medical practice.
So the mask, you're not wearing the mask to protect yourself.
Yes.
You're wearing the mask just in case you're infected and you didn't know.
Yes.
Then you do not spread as much of the virus to those who are around you.
Yeah, sure.
Now, if we both wear a mask,
then
even the person who is not sick reduces their chance.
Yes.
But is it that we are avoiding infection? The mask will not protect you from infection.
Yes.
What the mask does,
it
reduces the dose of infective material that you will get.
Yes.
So that you develop immunity instead of disease.
Wow.
So remember, the disease.
That is something I have not heard anyone talk about.
You see, that's what I'm saying. The idea is if it is given from that understanding,
Yes.
people cooperate because they have information.
Yes.
So what you're doing is empowering people.
Yes.
So I know we wrote an advisory as the Kenya Catholic Doctors Association on the use of masks.
Yes.
And basically that is what it is.
Yes.
Once you understand that it is likely we will all get infected.
Yes.
But the danger is not the infection.
Yes.
Is how much of the infective material you take in at the point of infection.
Yes.
That will determine whether you have just enough to help you build your immunity.
Yes.
Or you have taken so much that your immunity can't cope. You're going to develop symptoms and get disease.
Okay.
So it's the dose of infective material. So when you talk about being in church and in a mask, even the choir in a mask, then all we are doing is that.
Yes.
But once you go to the restaurant and once we go to the bar, and you remove that mask, and I am giving you a hot story, I'm shouting, and you're taking a deep breath, then you take a huge dose of this thing. And instead of developing an immunity, then so obviously some of those areas will be the last to open up. Okay, but the mask is really important. Now, from the point of infection, you develop your symptoms about third, fourth, maybe sixth day. And then by another week after that, your body, if it was capable of fighting, it fights this thing off. And in 10 days, that's the end of the story. You've developed a certain degree of immunity.
Okay.
So if you look at the way things are going, it is unlikely that there is people in Nairobi, there would be very few who haven't come into contact with this virus. And if you look at the statistics, all the counties have now been affected. The other thing that is in the science that is important for people to understand is that when you take the blood and check for antibodies in respiratory infections, the antibodies will climb maybe up to the second month, fourth month, then they will decline. By the sixth month, they are gone.
Okay.
But the type of immunity you develop against respiratory viruses is called cellular immunity.
Okay.
And that one you can't test with blood.
Okay.
It requires different types of tests, and they are not very easy to do.
Okay.
But if we were to be seriously scientific, what we would do is we would do cellular immunity tests against COVID-19. And that's the only way you can tell whether we have developed herd immunity.
Okay.
So it is wrong to say because your blood test for antibodies is negative, you have no immunity. In fact, if you remember the first SARS virus that came almost 17 years ago, there are people who still had cellular immunity that was positive now, and it was protective against this kind of virus. Okay. So if you understand that, and you understand the fact that the dose matters, the dose that you get matters, and determines whether you get disease or or immunity, then the mask becomes very important. The other thing that I'd like to say very clearly is that the status of your immune system is also important.
Okay.
And if your immune system is good, then you're likely to fight this thing off without major problems.
Okay.
But if your immunity is low because of age, because of other diseases that are autoimmune, diabetes, you have been on treatment for high blood pressure, you have HIV, you are on treatment for cancer, where the immunity is depressed, then of course those people become more vulnerable.
Okay.
So if you look at the risk of death among the young, is very, very remote. If you look at the risk of death among the elderly, then it can come up to 5%.
Okay.
So there is that, again, spectrum.
Okay, great. I think that is very, very helpful. Ladies and gentlemen, as you're following this conversation, I believe you're learning something. You actually realize that the idea of wearing a mask and preventing, shielding yourself from being a spreader is a very, very important phenomenon. And clearly, I think we made a lot of progress in that thing, and as a country, and most young people perhaps are not as high risk as the older people, as Daktari has explained to us. So the COVID-19 has created a kind of a crisis that I would almost think is part of this. The idea in the medical system and governance, there have been now, there is, I think, a strike going on right now among doctors. Really, I think when you look at that, what exactly is the problem? Is the problem our health system, the way we govern our health system, or is it just something that was going to happen eventually? So that's really been confusing.
We started our medical practice before the counties were formed. So before the new constitution, there were no counties, there was one government.
Yes.
And therefore the Ministry of Health was in charge of all health facilities.
Yes.
And the Ministry of Health was in charge of employing and deploying healthcare workers.
Yes.
So since all the hospitals the hospital that belonged to the government were managed under one umbrella, then there were also, the personnel were also managed from the same umbrella.
Yes.
It was very easy.
Okay.
So the country is in dire need of nurses.
Yes.
The country is in dire need of doctors.
Yes.
We don't have enough of both cadres.
Yes.
But because before the new constitution, doctors would finish and get posted immediately. And you finish your internship, you have a salary. There was no question about a doctor lacking jobs.
Yes.
Now, when the 2010 constitution came in, the issue about who is going to employ and deploy doctors became a major problem.
Okay.
So that you have some level of healthcare that was devolved to the counties.
Yes.
And the government was left with the other level. Okay.
Yeah. So
now, when it
referral hospitals.
Referral hospitals.
Yes.
So the people in referral hospitals are employed by the government.
Yes.
But the people who are in the other district hospitals and others are supposed to be under the county.
Yes.
Now there is a question of who should bring the facility, the drugs.
Yes.
Who should order for the drugs?
Yes.
Then if it is the county and it is the one that is employing, then the county would have to have its own budget.
Yes.
And the budget allocation of counties is from central government.
Yes.
And if there is delay in releasing funds, then there is problems with service provision.
Okay.
But the most devastating bit was the deployment and employment of healthcare workers being devolved.
Yes.
So now you have district hospitals that don't have enough doctors.
Yes.
But the county would not afford to employ the doctors.
Yes.
And you have doctors who are at home, jobless.
Yeah.
And yet we have a crisis of healthcare.
Okay.
So one of the things doctors had always proposed is a healthcare commission.
Okay.
Very similar to the Teacher Service Commission.
Okay.
So that the employment and deployment of doctors remains a central government function.
Okay.
And then everything else can depend on the counties. So that is where there is a bit of a problem in terms of governance.
Okay.
Now, when you have a union and the union calls on a strike, but the employer is not one.
Yeah, so you have different employers.
So you have different
county,
employers.
I've
So making a union nonsense becomes very easy.
Yes.
Because one county cooperates, the other one refuses, then the other one, and now you're dealing with 47 different groups to try and organize how this will be done. So that's where really the problem is.
Okay.
It is we need a central employer and deployer of healthcare workers.
Okay, that's well said, and clearly I think that has created so much confusion and compromised our health provision, and that's really is a big challenge. So now
there is of course the question about how the COVID the monies that were donated or borrowed as loans to use to take care of the PPEs, the things that the doctors and nurses needed in order to protect themselves against COVID. Again, was a very devastating blow to healthcare workers. especially in the public sector.
Yes.
Because you're saying, this thing is deadly, you'll be exposed to it every day. And sometimes you lack the basics. And then you hear how the money was used and the priorities that were given.
Yeah.
It's not a very good picture.
That's very, very saddening. That's very saddening indeed. Now, we cannot end before addressing, even though we won't go into the controversial side of the vaccine, but Dr. Gary, you have been in the news previously on issues to do with other kind of vaccine. As a medical doctor, you're familiar with the whole science around vaccine. I'll ask you to comment on what you really would like to comment on, and if there is something that you'd like to leave on the side, that you're free to do. But give us a little bit of insight on this vaccine business. Not necessarily the COVID vaccine, because that's still in the process. There are a lot of issues that are not clear. As you noted, COVID-19 is a very novel disease. So no one really would say they are expert, as you say. But we have had other vaccine issues. Maybe you could give us a little bit of light on that.
Yes. Now, the issues, the vaccine science is an old science.
Yeah.
But it is also important for us to know that the human race has existed for hundreds of thousands of years.
Yes.
Some people say millions. I'm not very sure about that.
Yeah.
But it is the immune system that is so robust,
yeah,
that you can live in an environment with contamination.
Yes.
And your body will be able to fight these challenges.
Yes.
And a few who have weaknesses will not make it.
Yes.
But there is always a group that will make it. Yes. And pass on this immunity to their children. And it's a very dynamic thing. So the first thing for us to understand as Kenyans,
yes,
is that the body is not helpless.
Yes.
So you're not saying that without a vaccine we shall all die.
Yes.
We are saying we will lose people.
Yes.
But there are those who will survive.
Yes.
And there are those who will develop immunity.
Yes.
Because even the Spanish flu came and went.
Yes.
Okay?
Yes.
And after COVID-19, who knows? There
yes.
could be a 20, there could be a 21.
Yes.
There are now mutant variants that are coming.
Yeah.
That are said to be more infective.
Yes.
The idea is that your body is not helpless.
Yes.
That's the first thing to learn.
That's important.
So the immunity has pre-existed vaccines.
Yes.
And it has protected us even before we developed vaccines.
Okay.
Now, the other thing is that when you want to eradicate a disease,
yes,
a vaccine is a very good instrument.
Yes.
But that disease must not be present in any other animal.
Okay.
That is how smallpox was eradicated.
Okay.
Because it couldn't exist in any other
okay.
form.
It only existed among humans.
Yes. So if you vaccinate the whole population against smallpox,
yes,
then you would be able to eradicate the disease.
Okay.
Because it has nowhere else to go.
Yes.
Unless it finds a human host.
Okay.
Okay?
Yeah.
So long as that bacteria or virus,
yeah,
or whatever else you're dealing with,
yes,
is available in any other animals.
Yeah.
You remember the coronavirus came from bats or whatever it is, the story is still unraveling.
Yeah.
But coronaviruses are there in almost all animals.
Yes.
It's not unique to the human
I hear
person.
even yes. chicken actually,
yes.
they have all kinds of
So you
viruses.
cannot talk about eradicating
yes.
the coronaviruses.
Yes.
It's a scientific impossibility.
Yes.
The other thing about vaccine science
yes.
is that when it began,
yeah,
it respected the natural immune system.
Yes.
So remember, the vaccine doesn't strengthen your immune system.
Yes.
It's very important that people understand that. The
okay.
vaccine does not strengthen your immune system.
Yes.
What the vaccine does is that it trains your body to identify the organism.
Yes.
So what I'm really doing is taking a bit of the infected material,
yeah,
putting it in you,
yes,
a small dose,
yes,
that will not give you infection,
yeah,
but will allow you to develop immunity.
Okay.
The same thing we talked about the mask.
Yes.
Okay?
Yes.
So the original vaccines
yeah.
then were inoculated in the skin.
Yes.
And the skin is called an epithelial surface.
Yes.
So you inoculate in the skin, it is the cells that come first.
Yeah.
They identify this thing, they
Yes.
fight it,
Yes.
and then they go and they tell the other parts of the immune system how to develop antibodies and things in preparedness for that.
Okay.
So smallpox was like that.
Yeah.
The BCG we get for TB
Yes.
is like that.
Yeah.
And the oral polio,
Yeah.
again, was going through the same route
Yeah.
that the infection would come through,
Yeah.
except you'd use a virus that is weakened.
Okay.
Okay, so that, but you respect the natural immune system.
Wow.
Now things become different
Yes.
when we started injecting, because when you inject now, you go beyond the natural immune system. You skip the epithelium
Yeah.
and go straight to creating antibodies.
Okay.
And anytime you inject,
Yeah.
then you can no longer inject the infective material alone.
Yeah.
You would need a preservative. You need something to enhance the reaction of the immune system.
Yeah.
You will have to grow it somewhere.
Yes.
Maybe yeast or in some, like you're hearing fetal cells. You have to grow it somewhere.
Yes.
And when you clean off that stuff, not everything comes out.
Yeah.
So you have heavy metals, aluminium, maybe mercury. So once we started injecting,
Yeah.
the science took a slightly different twist.
Okay.
And we started creating other issues.
Okay.
So when you're talking about a vaccine,
And we have to summarize because we
Okay.
have got only a few minutes.
yes, the thing is this.
Yeah.
When you're developing a vaccine,
Yes.
the first thing you want to understand is that you're going to give it to people who are healthy
Yes.
so that they don't get sick.
Yes.
If your side effect profile
Yeah.
of that vaccine
Yes.
is high,
Yeah.
then you're going to hurt more people than the disease would have hurt.
Okay.
So vaccines have a risk benefit analysis that
Yes.
must be done.
Yes.
And that is basically the science. You must be very careful. So if you look at the death rate of COVID-19,
Yeah.
so you're saying the case fatality rate, how many people have got the disease and identified how many have died,
Yeah.
then you're saying it is 1.75 in this
Yeah.
country.
Yes.
All right? But remember, the number of people who have been tested
Yeah.
are much fewer than the number of people who have been infected, because not everybody who was infected
Was tested.
was tested.
Yes.
So it means it is even lower than that.
Okay.
But if you look at a population of 50 million people,
Yeah.
and you say we have lost, unfortunately, 1,700 people,
Yes.
then you're looking at a fatality rate of 0.0035%.
Yes.
Now, if that is the risk of dying from the disease,
Yes.
the question is, do we need a vaccine? And that is what the question, that's $1 million question. Do we need it? Forget whether it is safe. Forget whether it is this. Does the severity of the condition require us to take a risk with a vaccine that may hurt more people than the disease?
Okay.
Yeah.
All right.
So is it necessary is a question to ask.
Okay. So we'll leave that not completely addressed. I mean, we've raised very, very serious issues on that. But I think I like what you have raised. You've shown that there is always a risk element
Yes.
in every vaccine situation.
Yes.
And the benefit. So you have to weigh between those two. And clearly what you're saying is that perhaps maybe we don't even need the vaccine.
That's the first question to ask. The second question is the vaccine that is available, the vaccines that are available now,
Yeah.
have been released for emergency use.
Yes.
Okay.
Yeah.
And their safety profile has been observed for just 2 months or 3 months.
Yes.
The data that is available has not been released. It was studied by whoever gave the emergency.
Yes.
So the thing is that this is not like the normal vaccines we already have,
Yeah.
that have gone through all the phases.
Yes.
This is released for emergency use.
Yes.
So even when we come to discussing it in Kenya,
Yeah.
the question is, we must look at our profile, not America's,
Yes.
not Europe.
Yes.
We must look at our profile of the disease in this country
Yes.
and ask whether we need an emergency attendance that has its own risks.
Okay.
Yeah.
So we'll leave it there.
Yes.
We'll leave it there. Thank you so much, Dr. Ngari. It was very, very lovely having you here. You've given us so much insight. And thank you, ladies and gentlemen, for watching the Gigi Report. I believe you've learned so much. That's all we have time for. We will end here. We look forward to having you next time on this show. Thank you, and God bless you, and keep watching Gigi Report. My name is Godfrey, and I'm glad you're watching. Thank you. Bye.